Okay, for some crazy reason I thought I'd make a video of this. It's that stupid stuff that comes into our laboratories. You saw a picture of this earlier, I've posted. And what I wanted to show you was the incomplete borders. They wanted me to make a provisional denture, a healing denture using this, an immediate basically, with no vestibular borders, or nothing. I mean, total horseshit. So I called them and said, oh, look, I'm going to make you a custom tray because there's just no way I can do anything with this piece of garbage. With that being said, okay, so how do I go about doing this? Well, here's my plan, and we'll see how it works. But I'm going to take and I'm going to outline where I think the borders, and when I say border, what I mean is where I think that the actual impression and then the deficiency begins, and I'm going to outline it. You can see where I've done. Then I'm going to carve this back with a carbide till it's smooth, and then I'm going to facilitate something to build a faux area in other words, a fake area, so that I can make a custom tray. Alright, so the plan is that, and I'll be back to show you what I came up with. So the first thing I'm going to do is I'm going to define like I did here. I'm going to grind away all that excess crap, and then I'm going to make a faux wall. I'll show you how I do that. Alright, I'll be back. Alright, so here it is in all its crappiness. As you can see, I outlined where it stopped, and then what I did was, just to show you, is that's all non-existent area, if you want to call it that. It's all the way around like that. Look at that. Alright, so the plan here is I've got to build a couple of areas up. I got to do it fast, and I don't want to mess around with a bunch of messy stuff. So I'm going to grab my GCLT putty, and I'm going to mold putty and build a wall all the way around this. That's the plan anyways. And then after I've got that all built up, then I'm going to do is I'm going to cover it with a layer of base plate wax so that I can block out all these teeth and probably block out some deficiency that'll be in this area, because I'm guesstimating. As you can see, this ridge form here, it's on that kind of an angle because there's a whole bunch of bone loss in that area, and so there's a depression there. So I'm guesstimating again, so I'm going to have to build it out just a little bit so that with the wax, so that I have a waxed out spacer that will slip over this whole thing. It might be some slop in the border area, but at least he'll be able to capture the borders and give me something better to work with. As you know, the deal with all custom trays is that the preliminary impression should be like hyper-extended. Like if they're going to use a stock tray, like I always tell them, just fill that thing with alginate and get everything, including the patient's uvula. I mean, I want it all, because then once I get all of everything, then we can reduce in size to make it custom. Custom isn't working from the minimal amount of information out. It's working from the maximum amount of information. The maximum amount of information, of course, being hyperextended impressions, and then taking them and then refining them so that they're custom. So again, I mean, if you want to like illustrate, or you want to tell your doctors who aren't giving you sufficient preliminary impressions, just tell them, look, we're working from the most information possible to refined back, rather than trying to figure out where the information is. Okay? So I'll be back, and then what we'll do is I'll put the putty on here, and I'll show you the next step. All right. Okay, I'm back with the idiotic tray, for lack of a better way to explain it. Okay, so here's what I did. I loaded that putty, built that putty up, that GCLT putty. Not much. 2 scoops of one and 2 scoops of the other, so 4 scoops total. To get myself something that would be carvable, and then also the acrylic tray. I'm going to use acrylic tray on this. Won't stick to. Obviously I could use the light cured products as well for the custom tray. But what I wanted to show you was, so in evaluating this, I realized that this is already kind of built out because of the fact that I ground it back, and it's probably far outside of the vestibular area, so why try to cut it in and then risk impinging that area? So I left it full, and then I just extended the putty, and again I put the putty all the way around. Okay, now I finger adapted it the best I can. So the next step is, after it sets up, I take my scalpel, and what I do is I hold it flush to the stone and just cut it even with. Now remember, I was talking about some areas are more deficient than others, so if I can do this and I can trim it back to the stone in those areas but have it extended, then I can do the next phase, which would be take a marker and trace out what I think would possibly be the tray extensions, how deep I want to go. Obviously I'm going to be thinking in terms of probably going shallower rather than deeper, but here I wanted to show you this area here. This area here is where that deficiency is. So by using my scalpel and following along the model, I can pretty much outline cut right up against the model here, like here. See here? See how I outline cut it? Again, this has already been determined as too full, but if I just outline cut it, that way I know where I'm at. I'm not going to do anything here. I've identified the hamular areas here and here, which seems to be okay, and this turns up in the back because of the throat form. So and the fovea is here, so I'm figuring that anything posterior of those fovea I won't have to worry about. And I put a hole in the middle of the palette to lock in the putty, and what I can do is I can just flick this away at some point. I'll do it now since we're talking about it. But then I'm going to overlay wax on that to block it out anyway, so it's not going to matter. But you can see that, okay, it seems like a lot of work, and it is a little more than I want to take on something like this, because I would just prefer that they get me a new impression, but they'd have to make their own custom tray, and I'd rather make the custom tray for them since they're going to have to do it anyways. And again, I'll just cut it back a bit, but you can see I followed what the model determined for the extension. All right? So anyways, that'll give you an idea. You can do it any way you want. I'm just trying to open your mind up to thinking about how do you attack this situation, this problem, and document it for you so that you can go back to it and say, hey, you know what, that Zaleske had a pretty good idea, but I bet might be able to modify it. And that's really what I'm doing. Sorry, I missed the area where the photo is. Okay. So anyways, you can see, again, if I place this against the scalpel, against the model, and carve out, it'll take out a lip that I might have there, because I'm going to overlay wax on it. See? Okay. I know it's stupid. I know I'm spending a lot of time on something like this, but you know what? I have to make them something that's going to work really easy, no-brainerish for them, because they're not going to want to do much. So I have to take into account who I'm dealing with and make it as easy for them as possible. All right, kids, I'll be back. Okay, back again with the next phase of what I'll call turd polishing 101. So I've now added the wax to block out the areas that I feel are going to be areas where I'm going to have some issues. And as you notice, it's actually underextended from where I had the lines on my putty and where my putty is, but I've yet to overlay this with acrylic yet to make the tray, so I'll be getting into that area. But with that being said, you can see what I did. And then on this side, in case you aren't already doing it, is that I cover the hamular ligaments because I want that to be blocked out so that there's no chance of tray compression on those hamular ligaments. And then I utilize two stops. I put the stops, since I had molars on either side, I put stops on the occlusals of the two molars back here so that that'll prevent the compression also. And I figured that the vestibular area will probably stop any of the forward over pressing, and I also have the incisal edges here that are actually pretty close to the edge of the wax. So with that being said, this is about as good as it's going to get. I'm going to go ahead now and cover this rascal with the tray material, and I'll be back to show you what I did in a minute. Alright, last go around here. So let me show you what I've done. Here's the custom tray. That putty came loose. Here's my custom tray. You'll notice on the inside I highlighted in red the two stops that I had on those molars, just so you could get a good look at that and see. Those two stops will now prevent it from being pushed into the posterior too far. I also put several holes in the tray. I do that and routinely. I also put them back here in the hamular region or in the retromolar on the lower, because I want to make sure that there's no material that when we're putting the tray in, when it comes down, I'm making sure the material doesn't hydrostatically hang. I want it to be able to come out that hole so that it can impress that area nicely. Okay? And I put one mid-palatally for the same reason, and then one up front of those two teeth to make sure that it locks in nice. I don't want to have this pull. When they go to pull it, I don't want the impression material to pull out. And sometimes when they use adhesive on the inside, it still will pull from it and you won't even know it. So at least this helps a little bit with the accuracy. I put a handle on it, and I put handles on the same way all the time, and that is I put them in line with the way the teeth would be in the front. And the reason I do it that way is because if I had it this way, what it does was it will push the lip away. When they go to pull it, it will open the vestibular area too wide. And so I make them this way so that they can be pulled like that, straight up and down. Anyway, that's the design. A little bit about how I fabricated and figured out the borders is I made the initial tray, put it on, and then I traced, and you'll see there's lines way up high here where I traced with the pen to get me started. And then what I did was every time I reduced, I continued to reduce, and then I would draw a line. I would trace again with the tray in place. I would trace over this to see where I was on the model to give me an idea of how much I had open. When I got it to where I wanted, you'll notice I have highlighted it in red just so you can see what I did. But yeah, this is going to serve them okay. A note will go in the box which will also specify that they take and trial it in first. In other words, put it in without any impression material in it first to make sure that there's no vestibular impingements from the length, because these are just guesstimated, they're not actual. So we'll do that. A lot of work for a friggin' tray when all they had to do was just use a stock tray, overload it with alginate, and give me something with a full breadth of everything. So instead I had to work about an hour on this to get it the right way, and it's a loss of time because I can't charge all that much for a custom tray. I do, but it isn't what it really deserves to be charged for. Anyway, that's where it is, that's what it is, and that's how it is. And I hope you got some value from this. Maybe you don't use the whole technique, but maybe there's a couple little things like the tissue, like the stops or something like that, or the way I can, put the tray together, or the way I trimmed it, or something like that might help you out. All right, till the next time we meet, this is Tom Zaleske signing out.